Hello friends, let us now learn some new questions in the previous year question paper. So, which of the following are true about posterior epistaxis? So, posterior epistaxis, which of the following are true? For posterior epistaxis, posterior packing is done. 2. True. Associated with chronic hypertension, yes, it is associated with chronic hypertension. Persistent case is ligation of anterior ethmoidal artery. So it is a posterior epistaxis. So ligation of anterior ethmoidal artery does not have any role in posterior epistaxis. In posterior epistaxis, we should ligate the maxillary artery is done. But previously, but right now we do mainly the sphenopalatine artery ligation is done now. Sphenopalatine artery ligation is done in posterior epistaxis. Severe bleeding in comparison with anterior epistaxis, true. More common in elderly, true. Then next question, which of the following are true? Which of the following are true? First, internal laryngeal nerve supplies the cricothyroid muscle. Internal laryngeal nerve supplies the cricothyroid muscle. No, cricothyroid muscle is supplied by external laryngeal nerve, a branch of superior laryngeal nerve. It is supplied by external laryngeal nerve, a branch of superior laryngeal nerve will supply the cricothyroid. Next, internal laryngeal nerve supplies the sensory supply below the vocal cord. Not internal laryngeal nerve. Below the vocal cord, it is supplied by recurrent laryngeal nerve supplies the sensory supply below the vocal cord. Then internal laryngeal nerve will tense the vocal cord. No. Tensor of vocal cord is actually cricothyroid and vocalis. So superior laryngeal nerve, that is external branch of superior laryngeal nerve, will tense the vocal cords. External laryngeal nerve tense the vocal cords, true. Internal laryngeal nerve supplies the sensory supply above the vocal cord, true. Internal laryngeal nerve is a branch of superior laryngeal nerve. It will cause sensory supply to the vocal cord. Next question. All are true about Meniere's disease except triad of recurrent vertigo, fluctuating sensory neural hearing loss and tinnitus is seen. True. Treatment consists of use of thiazides. Thiazides are used in Meniere's disease to flush out the excess fluids which are seen. Then drop attacks are seen, which are also called as Tumarkin's attacks are also seen in Meniere's disease. Then onset is after 50 years. No, it is actually seen in younger age group, not the older age group, not this old. It is seen in 35 to 60 years and it is more common in males than in females, right? Next question. Pure tone audiometry, true is. It is testing the frequency. The frequency tested is 2000 to 9000 hertz. Actually frequency tested is 125 to 8000 hertz of air conduction and 250 to 4000 hertz of bone conduction is tested. Done in a silent room. Yes, it is done in a silent room. Air conduction of right ear is represented by O. See, it is two things. Air conduction of right is represented by O if it is unmasked. Unmasked air conduction is represented by O in right ear, and if it is masked, it is represented by triangle if it is masked. Air conduction in the left ear is represented by cross if it is unmasked, and if it is masked, it is represented by square if it is masked. Okay, next question. True about presbycusis is degeneration of outer hair cells of organ of Corti in sensory type. True. It can be higher frequency is affected first in sensory type. In presbycusis, higher frequency is associated first in sensory type. Can be treated with hearing aids. Yes, we can treat this with hearing aids. Usually unilateral hearing loss occurs. Usually this presbycusis is bilateral. Hearing loss is seen usually. Next question. Toby-Ayers test is used for. It is used for lateral sinus thrombosis, or also called as sigmoid sinus thrombosis. We use Toby-Ayers test. This Toby-Ayers test is if you compress the both jugular veins of both the sides, one or both the jugular veins, then you will see the increase in CSF pressure, which can be measured by manometer. Next question. Stridor is caused by all except. Stridor is caused by vocal cord palsy causes stridor, stenosis after tracheostomy, Ludwig's angina, retropharyngeal abscess, even right bronchial foreign body occlusion. All these will cause stridor. Thank you for watching.